So कोई भी surgery, whatever surgery we do, our first and primary aim is that it should benefit the patient. Second thing is that it should make the surgery more accurate, it should make the surgery more friendly to the surgeon. And third part comes the education. So robotic surgery serves all the three purposes. First of all, because of the technology, the accuracy is much more in the robotic surgery. Now we know that in knee replacement surgery, it is the accuracy which matters, because if the alignment is not good, then the functional results are not good and the implants don't last long. The robotic technology helps us to put the implant in perfect alignment and the balancing is very good. So the functional recovery is very good, the pain is less, and these implants last longer. So that is for the patient part. As far as doctors are concerned, it makes the surgery easier, because now with the technology we can calculate each and everything. We can do the planning, the virtual planning before the actual surgery. So basically we are doing a virtual surgery before the actual surgery. So that way it makes things easier for the surgeons also.